Hi everybody. So today we're going to be talking about how to read an EKG. And an EKG basically measures the electricity as it passes through the heart as the heart is going through its cycle of contraction. So let's take a look real fast. And before we start, there's just some terms I want to go over. And the first one is the term depolarization. All right, so when we talk about depolarization here, as you know, in depolarization, when muscles contract, I'm just looking for a different marker here. When when nerves undergo depolarization, sodium rushes in, and then at a certain point, potassium rushes out, and that's repolarization. So when we're talking about an EKG, the depolarization is basically going to be when muscles contract. Okay, when the heart muscles contract. And then when we talk about repolarization, what we're going to be talking about is when the muscle returns back to its normal resting position or situation, okay? So in repolarization, the muscles return to normal, right? And they rest, they're relaxing, they rest while waiting for the next beat. And we'll go into this in just a minute. For the next heartbeat. Okay, so those are two terms I want you to know. So what's going to happen here is electricity is going to make the heart contract, and here it's after the muscles have contracted, they're going to start to relax. So let's go ahead and take a look at this now. And we've seen this all, I'm pretty sure we've all seen this before. And let me come over here. And so this would be basically the heart resting. It just got done with a beat. Now it's getting ready to do the next beat. And when we're done on that end, we're going to kind of see this line too. And then I'm going to have this here, which I'm going to call my P wave. And then we're going to have, it's going to go like this. And then we're going to go like this. And then like that, okay? And again, this is just a really simple explanation, by the way, of what happens in an EKG. So now, this right here is going to be my P wave. So what's going to happen in the P wave is this. Is in the P wave, my atria, which are on the top of the heart, are going to contract. So the atria depolarize, right? So in other words, they are going to contract. Now, for the most part, in the atria, what happens is, because we're on the top of the heart, once the valves open, about 70% of the blood just naturally flows into the ventricles, which are in the bottom part of the heart. So it doesn't need a whole bunch of contraction. However, about 30% of the blood does need to be pushed out, and that's what's going to happen in the P wave here, okay? So the atria are going to depolarize and contract. Now what I'm going to do is I am going to draw a little heart right here, all right? And this again is my right atrium, and this will be my left atrium, okay? And what we just described happening now is the top part contracting, okay? So let's go ahead now and go on from there. And if you notice now, right here, this is a flat line. So basically no electricity is being conducted at this time. This is due to the AV node. The AV node is stopping the impulse. Okay? So basically, let me write it right here. Between my P wave, and we're going to call this here the Q wave. So between the P wave and Q wave, the flat line represents where the impulse has been stopped, so that the ventricles can fill with blood. Okay. Okay, so if we recall, when we were talking before, or when we talked in another video, I have basically my SA node is up here, and then I have my AV node down in here, and the SA node is going to send signals not only to the atria to make them contract, but also to this AV node. And then the AV node is going to stop that signal, and that's what you see happening right here. So these are contracting, this is keeping the ventricles from contracting, and stops the signal right here. I know that's kind of hard to see, but it's going to stop it right there. So let's go on now, and let's look at the Q wave here. As you see, there's a Q wave right here. So this is what happens with the Q wave is after the signal has been stopped at the AV node, what's going to happen is the signal is now going to go down into the bundle of His. So that's going to be my bundle of His that's right here. And then I am going to get the branches on each side. All right? These are my bundle branches on each side that are right there. In the Q wave, what's happening here, this has been stopped right at the AV. In the Q wave, what's happening now is the signal is going down into the bundle branches on either side of the ventricular septum. And so it's making the ventricular septum start to contract. Now, this whole cycle right here is going to take place in just a short amount of time. So it's going to be basically one whole unit together. But now I'm starting to get the signal to go down through here. So in the Q wave, what's going to happen is I am going to have the impulse, the electrical impulse, goes from the AV node, okay, from the AV node to or through the bundle of His. And again, I know this part down here is hard to see, but that's the bundle of His that's right there. Bundle of His into the bundle branches. Remember, you have a right and left bundle branch. Okay? And it's going to make the ventricular septum start to contract. And depolarizes. Okay, remember, depolarize in this case is going to mean contract. Depolarizes the ventricle septum. Now, I should actually say ventricular septum, but I'm just going to say ventricle septum, okay? So in other words, this is now going to start contracting. This contracts, okay? That's what's going to be happening there. Now, again, you see these lines on the outside of this ventricle right here, right? But technically it's inside the muscle there. So now, that's the Q wave. Now the next thing we have to do is we have to get the rest of that ventricle to contract. We want this part here, where this muscle is here, we want that to, oops, just caused a leak in my heart. We want that part to contract to pump blood out. So let's take a look at this now. And my bundle branches are going to come down and they're going to go out this way, and they're going to come down and they're going to go out this way. Okay, and again, this is all inside the muscle, okay? I know I'm making it look like it's outside. I'm going to make this pretty thick here. And you actually have little branches coming out from that, which I'll talk about in just a minute. So what's going to occur now is that impulse is going to come down and start to go into this part of the branches here to make the ventricles contract. And because those muscles are so thick, they require a lot of electricity to make it work. So this is going to be our R wave. So in the R wave, the electrical impulse depolarizes the ventricle walls. Okay, which are the muscles. Okay, so it's going to depolarize the ventricle walls, which are the muscles. And remember, that means they contract. So, in other words, they're going to contract. Okay, so this part here is these parts here now are contracted. So the Q wave was the ventricular septum's contracted, and the R wave is now the ventricular walls or the side of it contracted. Okay, and that, like I said, that's going to require a lot of energy, and that's why it has such a big spike there. Let's go on to the next part. The next part is going to be the S wave. Okay, now what's the S wave? Well, coming off of these here, you actually have branches. That these little green things would be coming off those branches. I'm just going to draw it like this. And these are called Purkinje fibers. All right. So now, again, the Purkinje fibers are also inside. The Purkinje fibers are also inside the muscle there. So now, this is going to be in my S wave. Okay, which is this part right here. So now, my Purkinje fibers depolarize. And when they do depolarize, also causing the ventricle walls to contract. Okay, so you may be saying, well, wait a minute, didn't the R wave do that? Yes, it did, and this does it too. And remember, this has all basically happened simultaneously, even though it looks like it's spread out. It's basically happened simultaneously. So now we're going to come over to here to the T wave, which is right here. Now in the T wave, we're going to get repolarization. Things are going to start going back to normal. In other words, all through here, we basically had the sodium rushing into the nerve, and when that happened, it made the muscles contract. Now we're going to have the potassium coming out of the nerve, which is actually going to make the ventricles relax and get ready for the next heartbeat. Okay, so now on the T wave, okay, the ventricles repolarize. And relax and wait for the next heartbeat. Okay, so that's what's going to happen there. Now, here's the thing, is you may say, well, wait a minute, on this here, we had the ventricles were basically repolarizing, right? And they're relaxing, waiting for the next beat. Why didn't the atria do that? Right? They beat it. These beat to make the blood go down. Don't they repolarize? And the answer is yes. But when they do it is during this QRS segment here. Okay? And that's when they're going to do their repolarization. So you don't see it because it's actually hidden in there. Two more things. First of all, if you notice, we have this area that's right in here. Right? That's a flat line. And basically on this flat line here, we're going to call this the ST segment. So in the ST segment, because we don't want to call it a wave, right? So in the ST segments, between my S wave and my T wave, there's no conduction. No electricity is conducted. All right. However, if someone were to have a heart attack, a myocardial infarction, or some type of ischemia, this is either going to go up or down, just depending on how far along we are conducted. It may go up or down in And I'm going to put MI for myocardial infarction. Myocardial infarction is a heart attack, okay? So if we're having a heart attack, you may see this start to go up, it may come down, just dependent, okay? So, that's the ST segment. That is basically it for of how to read an EKG. This is a very general explanation of it. For anyone who's in the medical field, this is actually a semester course, if I understand correctly, learning how to read these. One last thing. Over here, this is basically going to be a continuation going on to here. So what I could actually do here is then draw my P wave again. Okay? So, that's reading the EKG, and thank you so much for watching.